What if the one drink you have every night to relax is quietly raising your cancer risk, even if you never feel drunk, never overdo it, and have done it for years thinking it was harmless? That is exactly what a major new study is telling us in 2026. And the findings are shaking up everything we thought we knew about moderate drinking and health. Welcome to Dr. Medora Health. Today we are breaking down this new research in plain, clear language, what it found, why it matters, which cancers are most connected to alcohol, and most importantly, what you can actually do with this information starting today. Stay with me, because this video could genuinely change how you think about something millions of people do every single day. So let us start with the big headline. A comprehensive new study published in 2026 has reinforced and significantly strengthened a conclusion that has been building in the medical community for years. There is no completely safe level of alcohol consumption when it comes to cancer risk. Not one glass of wine with dinner, not a single beer on the weekend, not a small pour of whiskey before bed. Any amount of alcohol, according to the current body of evidence, increases the risk of developing certain cancers. Now, before you feel overwhelmed or defensive, let me be very clear about what that means and what it does not mean. This does not mean that one drink will give you cancer. Cancer is complex. It develops from many factors: genetics, environment, lifestyle, and yes, what we consume. What the research is telling us is that alcohol is a contributing factor, a risk modifier, and that risk starts at the very first drink, not at some imaginary threshold of excess. That distinction is critically important, and we are going to unpack it carefully. Now, here is something that surprises a lot of people. Alcohol has actually been classified as a Group 1 carcinogen by the International Agency for Research on Cancer, which is part of the World Health Organization. Group 1 means there is strong, convincing evidence that it causes cancer in humans. It sits in the same classification as tobacco smoke and asbestos. That classification has been in place for years, but most people have never heard it because the public conversation around alcohol has historically focused on heart health and moderate drinking rather than cancer risk. That conversation is now changing, and this 2026 research is part of what is driving that change. Let us talk about the biology. Why does alcohol cause cancer in the first place? The answer lies in what happens inside your body when you drink. When you consume alcohol, your body metabolizes it. The first step of that process produces a substance called acetaldehyde. Acetaldehyde is highly toxic and is classified as a probable carcinogen on its own. It damages DNA inside your cells. It prevents your cells from repairing that DNA damage, and damaged, unrepaired DNA is one of the core drivers of cancer development. Here is the part that makes this relevant even for light drinkers. That process, alcohol being converted to acetaldehyde, acetaldehyde damaging DNA, happens every single time you drink, with every single serving. Your body does not wait until you reach a certain number of drinks before it starts producing acetaldehyde. It begins immediately. Alcohol also increases estrogen levels in the body, which is one of the reasons it is so strongly linked to breast cancer. It creates oxidative stress, which damages cells broadly. It impairs the absorption of important nutrients like folate, which plays a protective role in DNA synthesis and repair. And in the mouth and throat, alcohol acts as a solvent, making it easier for other carcinogens, including those from tobacco, to penetrate the cells lining those tissues. All of these mechanisms are active with low levels of alcohol consumption, not just heavy drinking. And this brings us to the specific cancers. Because it is not every cancer, it is a defined and well-documented list. And some of the cancers on this list are going to surprise you. The strongest and most well-established links are to cancers of the mouth, throat, voice box, esophagus, liver, colon, rectum, and breast. These are sometimes referred to as the alcohol-attributable cancers. The evidence connecting alcohol to these 7 cancer types is considered robust and consistent across many studies conducted over many decades. Now let us walk through a few of the most significant ones, because understanding the specific connection can help make this feel more real and actionable. Breast cancer first, because this is one that many women are completely unaware of. Research has consistently shown that even one alcoholic drink per day increases a woman's risk of breast cancer. According to the American Cancer Society, women who have 1 drink per day have a very small but measurable increase in risk, and that risk continues to grow with each additional drink. The mechanism, as we mentioned, is largely driven by alcohol's effect on estrogen levels. Higher circulating estrogen over time is a well-known driver of hormone receptor-positive breast cancers. For women who already have other breast cancer risk factors, family history, dense breast tissue, certain genetic variants, the addition of even moderate alcohol use compounds that risk further. Colorectal cancer is another critical one, especially given that rates of colorectal cancer are rising in adults under 50, which is a trend that has been alarming gastroenterologists and oncologists for the past several years. Alcohol appears to affect the gut microbiome, promote inflammation in the colon, and increase exposure of the colon lining to acetaldehyde. Studies show that even moderate alcohol consumption is associated with a meaningfully increased risk of colorectal cancer compared to non-drinkers. Liver cancer is perhaps the most intuitive connection. We know that heavy alcohol use causes liver disease, fatty liver, then cirrhosis, and cirrhosis is a major risk factor for liver cancer. But the evidence also suggests that alcohol can promote liver cancer through direct carcinogenic effects, not only through the root of cirrhosis. Esophageal cancer deserves attention here because it has one of the lowest survival rates of any cancer, and alcohol is one of its most significant risk factors. The cells lining the esophagus are directly exposed to alcohol with every sip. The combination of alcohol and tobacco dramatically multiplies the risk, a powerful synergistic effect that makes the combination far more dangerous than either factor alone. And mouth and throat cancers, also called oral and pharyngeal cancers, follow the same pattern. Direct tissue exposure to alcohol and its carcinogenic breakdown products made worse when combined with tobacco use. Here is something I want you to sit with for just a moment. The 2026 research contributes to a broader and evolving scientific consensus that there is no risk-free level of alcohol when it comes to these cancers. That is a significant shift from messaging that many adults received for years, messaging that suggested 1 or 2 drinks per day was not only acceptable, but might even be beneficial for heart health. Let us talk about that heart health claim, because it comes up every time this topic is discussed. For years, studies suggested that moderate alcohol consumption, particularly red wine, was associated with a lower risk of cardiovascular disease. This was used by many people as a justification for regular drinking. A glass of wine a day was practically a health recommendation in some circles. But here is what newer and more rigorous research has revealed. Many of those earlier studies had significant methodological problems. One of the biggest flaws was something researchers call the sick quitter effect. In many studies, the group of non-drinkers included people who had stopped drinking because they were already sick, people with established health problems who had quit alcohol for medical reasons. When you compare current drinkers to a group that includes a lot of unwell former drinkers, the current drinkers can look artificially healthier. It skews the data. When researchers use better study designs, particularly a method called Mendelian randomization, which uses genetic data to more reliably assess causal relationships, the apparent cardiovascular benefits of moderate alcohol largely disappear or become much less convincing. And the cancer risks remain clearly present. So the current evidence-based position from major health organizations, including the World Health Organization and increasingly the American Cancer Society, is that alcohol is a carcinogen, and reducing consumption or eliminating it is a meaningful step toward reducing cancer risk. Now here is something important I want to address, because I hear this concern often. Does this mean that if you have been a moderate drinker for years, you have definitely done serious damage and there is nothing you can do? Absolutely not. And this is where the conversation becomes genuinely hopeful and empowering. The human body is remarkably capable of healing and reducing risk when given the right conditions. Research shows that when people reduce or stop alcohol consumption, their risk for several alcohol-related cancers begins to decrease over time. It is not an immediate reset. Cellular changes take time to reverse, and some damage from years of heavy drinking cannot be fully undone. But the trajectory improves. For someone who has been a light to moderate drinker, the cumulative risk increase is relatively modest in absolute terms. Choosing to cut back now is still meaningful. It still matters. The biology is not a one-way door. And for younger viewers or those who have not yet established a heavy drinking habit, the message is even more straightforward. The best time to make informed choices about alcohol and cancer risk is before those risks accumulate. So what does this mean practically? What can you actually do with this information? Let me give you a clear and actionable set of takeaways. The first and most straightforward step is to understand where you currently stand. Be honest with yourself about how much you are drinking. Not how much you drink on the best weeks, but on an average week. A standard drink in the United States is defined as 14 grams of pure alcohol. That is roughly 12 ounces of regular beer at about 5% alcohol, 5 ounces of wine at about 12%, or 1.5 ounces of 80-proof distilled spirits. Many people are drinking more than a standard drink per serving without realizing it, particularly with home pours. The second step is to think about reduction rather than perfection. If eliminating alcohol entirely is not your goal or does not feel realistic right now, reducing your consumption still meaningfully reduces your risk. Going from drinking daily to drinking a few times per week is a positive step. Going from multiple drinks per occasion to one is a positive step. Every reduction matters biologically. Third, if you do drink, certain habits can help reduce related risks. Making sure you have an adequate intake of folate, found in leafy greens, legumes, and fortified foods, is important because alcohol depletes folate, and folate plays a protective role in DNA health. Staying well hydrated, maintaining a healthy body weight, avoiding smoking, particularly in combination with alcohol, and keeping up with recommended cancer screenings are all meaningful parts of a comprehensive risk reduction strategy. Fourth, talk to your doctor. Especially if you have a family history of any of the cancers we discussed today, breast, colon, liver, esophageal, oral, or throat cancers, your personal risk picture may warrant a more specific conversation with your healthcare provider about alcohol and other lifestyle factors. And fifth, and this one is about your broader approach to health information, pay attention to how the science is evolving. The guidance on alcohol has shifted substantially in recent years, and it is still evolving. Organizations like the World Health Organization, the American Cancer Society, and the National Cancer Institute are increasingly aligning on the message that no amount of alcohol is without cancer risk. Staying informed from credible sources helps you make choices that are actually based on current evidence rather than outdated assumptions. One more thing I want to touch on, because this is a nuanced topic and fairness matters. Some people will watch this video and feel anxious or guilty about alcohol they have consumed in the past. I want to address that directly. The goal of sharing this research is not to create fear or guilt. It is to make sure that people have access to accurate information that was often not widely communicated. Information that empowers rather than paralyzes. Many factors influence cancer risk. Alcohol is one of them, and it is one of the more modifiable ones. That is actually good news. Unlike your genetics, unlike your age, unlike certain environmental exposures, your relationship with alcohol is something you have meaningful control over. That is why the science matters, because it can directly inform choices that lead to better outcomes. Let us recap what we covered today. New research in 2026 reinforces the scientific understanding that any level of alcohol consumption increases cancer risk. Alcohol is classified as a Group 1 carcinogen by the International Agency for Research on Cancer. The cancers most strongly linked to alcohol are cancers of the breast, colon and rectum, liver, esophagus, mouth, throat, and voice box. The biological mechanisms include DNA damage from acetaldehyde, increased estrogen levels, oxidative stress, and impaired nutrient absorption, all of which begin with the very first drink. Earlier studies suggesting cardiovascular benefits from moderate drinking have significant methodological problems, and more rigorous research largely undermines those claims. Reducing or eliminating alcohol consumption reduces cancer risk over time. Practical steps include honest self-assessment, gradual reduction, folate-supportive nutrition, staying current with recommended cancer screenings, and having informed conversations with your doctor. This is exactly the kind of health information that too often stays buried in medical journals and never reaches the people who could benefit from it most. If this video gave you something useful, a new perspective, a reason to think differently, or even just a good conversation to have with someone you care about, please share it. Pass it along to a friend or family member who you think might benefit. And if you have questions or thoughts about what we discussed today, leave them in the comments. We read them, and your questions help shape future videos. Subscribe to Dr. Medora Health so you never miss evidence-based health information delivered in a way you can actually use. Your health decisions deserve to be built on the best available science, and that is exactly what we are here to provide.